I am Dr. Pravin Bandokar. I am a consultant dermatologist practicing in Mumbai. I'm practicing since the past 18 years, and I have my clinic here at Matunga, which is located in Mumbai. I'm also attached to Saifi Hospital, and I'm a member of many organizations like the Indian Academy of Dermatology, the CDSI, and many other international memberships.
So, doctor, what exactly is psoriasis?
So psoriasis is a chronic inflammatory condition of the skin, which is immune mediated and causes a lot of redness, itching, scaling, and discomfort. It is not contagious.
What are common myths around psoriasis?
So there are a lot of myths that come along with the patients when they walk in the clinic. The most common is that it is contagious. Remember that psoriasis is not contagious. It can be completely cured. No. Psoriasis cannot be completely cured. It can be definitely controlled in a complete manner. And one of the most important other myths that that people bring along, that it is basically can be treated with just home remedies. Please remember, psoriasis being a chronic inflammatory condition need proper medical line of therapy.
What are the current treatment options?
So there are many treatment options. Topical medications, which include like steroids, vitamin D analogs, salicylic acid ointments are the common ones that are used topically. The other treatments include phototherapy, oral medications like methotrexate, azathioprine, and many other immune suppressive medications. Biologics are one of the other lines of treatments which can be taken through injection formats.
What are the limitations of current treatments?
So the current treatments are limited with side effects. There are a number of side effects that we see when it comes to medications which are especially systemic, which are causing a complete immune suppression. We need to monitor the liver function test, the kidney function test in many of the patients. Topical line of treatments, for example, steroids, can be associated with a lot of dyspigmentation, that is changes in the color of the skin, thinning of the skin, or even associated with sometimes systemic absorptions. Phototherapy can be associated with excessive burns on the skin and can cause even long-term damages on the skin.
Are there newer approaches that focus on managing psoriasis more safely for long-term use?
Yes, definitely. There are many newer options that are available that basically focus on immunomodulation and not complete immune suppression. We have understood the pathogenesis of psoriasis in a great way now, knowing all the inflammatory paths that we need to focus on. So working on regulating these inflammatory pathways or the immune suppression pathways and getting a good level of control on the immunological disturbances that happen is definitely a newer line of treatment approach. Many plant-based derivatives which are of special interest, which focus on regulating this immunological disturbance, is something that we are looking forward to.
Are there any natural or plant-based ingredients that are being explored for psoriasis management?
Yes, there is a lot of research that's been done in a particular, plant-based ingredient from Sphaeranthus indicus. The bioactives or the extract from Sphaeranthus indicus have shown a lot of anti-inflammatory properties. They are known to even regulate the immunological disturbances that happen, and they tend to work via different bioactive pathways or the inflammatory pathways that are there triggering the psoriasis. So for example, you have the tumor necrosis factor alpha, or you have the cytokines, the interleukins, the JAK-STAT pathway. This particular bioactive from Sphaeranthus indicus, which has been under research for the last decade or more, has been found successfully to regulate the disturbances that you see in these pathways of cytokines and inflammation. So by controlling the cytokine storm or the TNF-alpha effects on the cells, it helps to bring about a good regulation and a better control of psoriasis.
How can such ingredients help patients in psoriasis management, and what's your experience been so far using this extract?
So this particular extract from Sphaeranthus indicus works very well in controlling the redness, the inflammation, the itching, and the discomfort in the patients. My experience over the last, few months or maybe even a year or so is that, the molecule works as a very good adjunctive treatment in my, practice. It works in regulating the immune system. It overall improves the way the psoriasis is responding to other lines of treatment. So I can, use it, broadly in my management of the patients of psoriasis that we see. There are patients who have had, severe irritation, severe discomfort, redness, and even thickness of the skin over the, palms, over the back of the hand, over the knees, the shin area, which were, not responding very well to topical steroids. Or even there were patients who were getting side effects related to the oral systemic medications like methotrexate. Such group of patients can be definitely immediately transferred onto, a bioactive molecule like this, because we know that it doesn't put too much of a load on, the liver and the kidney systems. So these group of patients also responded very well in terms of both an acute therapy of the psoriasis flare as well as in the long-term management as a form of a maintenance. So the first thing that we have seen, when I've written this molecule for patients is a big control over the discomfort or the itch that the patients get. So it's able to control the itching over a period of around 2 weeks' time, which is normally not seen that much with, the immune suppression group of medications, except, of course, for a few like cyclosporine. But definitely as a form of a bioactive, extract, the effect that you see is quite commendable. Yes.
So in what forms are such ingredients typically used?
So these Psoriasis indicus is available in oral capsule format. There's a dose of around 700 milligram that you can give, once in the morning, once in the night to slowly introduce this molecule. And then we can also make it equivalent to 2 tablets in the morning and 2 tablets in the night. So that's around 2,800 milligrams per day. And this particular amount or the dose given to the patient is good enough to bring a good control in chronic plaque psoriasis, even in patients who have more than 20 to 30% of the body surface area involved. It is also available as topicals. We write the topical cream. It doesn't have much of the side effects like what we see in corticosteroids. It also works as an enhanced moisturizer, in the area where it is able to heal the barrier damage and at the same time bring about a better control of the inflammation by working on the localized, immune or the cytokine storm that is happening in the dermal area of the skin. It is also available as a cleanser. There is a body skin cleanser that's available that can be used daily for bath on the affected areas and works as an excellent adjuvant to our lines of treatment. And then you also have a scalp cleanser for those specific patients who have scalp psoriasis and where scalp psoriasis is causing a lot of itching and discomfort and disturbance to the patients. So using it as a scalp cleanser, again, once a day on a daily basis, and then you can even reduce it as a maintenance to 3 days in a week or 4 days in a week when condition is in a much better control.
Which patients may benefit the most from such approaches?
So I think individuals who have mild to moderate psoriasis, the molecule functions very well in them. In the very severe cases, in my experience, I've not seen a good response. But yes, the initial stages where you have a mild to moderate psoriasis stage, it definitely works well. Even can be used, as I said earlier, as a maintenance in terms of long-term management, for individuals who have chronic plaque psoriasis over the knees, elbows, and other areas. And of course, people who get scared of steroids, who fear steroids or steroid phobia group of patients. Those group of individuals as a topical line of medications supported by an oral line of medication and the cleansers is the right way to approach patients.
What should patients keep in mind before choosing such treatments?
So it's extremely important to visit the expert. Okay, as dermatologists, we are the frontline warriors of treating psoriasis. So one should definitely visit a dermatologist, before starting such kinds of treatment. As I had mentioned earlier, this molecule from Psoriasis indicus has, backup research of more than a decade. It's quite effective in immune regulation and brings about a good control in the psoriasis patients in different scenarios that we discussed earlier. So I think visiting a dermatologist, using the treatment very regularly, getting a good follow-up with your dermatologist are the key points in bringing your psoriasis under good control.
So, doctor, is there any kind of test or investigation that a patient should go through, before starting or during using this extract?
I think this is a very relevant question because as we know, psoriasis is a chronic inflammatory disorder, and therefore the treatment also requires a long-term intake of this particular, medication. So I think patients who are in a specialized, category kind of situation where you have a past history of a liver disease, or you have non-alcoholic fatty steatosis, that is fatty liver basically, or those individuals who are having certain past history of kidney issues like a raised serum creatinine, etc. I think it's important to monitor the liver function tests and the kidney function tests in such situations. The other kind of test that I would probably is screen patients for tuberculosis. As we know, India is the capital of tuberculosis. We never know where or who has tuberculosis, where tuberculosis is in an inactive form in the patient. And when you give medications which are not only immunoregulating, but they touch the immune system, it's important to screen patients for tuberculosis, where we commonly do certain tests like a IGRA-TB test, which is commonly available at the labs to rule out latent tuberculosis. Apart from these, I think it's important to monitor your CBC, that is a complete blood count, the ESR, just to make sure that the patient is not getting any other form of side effects and the health is under well controlled.